Can new tech like biofeedback treat stress incontinence? Imagine being able to better control those sudden leaks when you cough, laugh, or exercise. Stress incontinence affects many people, especially women, and can impact daily life. It happens when the muscles supporting the bladder and urethra weaken, often due to childbirth, aging, or surgery. While stress incontinence isn't directly linked to bladder cancer, both conditions can affect bladder health and quality of life. Managing it is key to staying active and confident. Biofeedback is a technology-assisted therapy designed to help people become more aware of their pelvic floor muscles. During biofeedback sessions, sensors are placed on or inside the body to monitor muscle activity. The data is displayed on a screen, showing whether you're contracting the right muscles or not. This feedback helps you learn how to strengthen those muscles through targeted exercises. The goal is to improve bladder control by training your pelvic floor muscles effectively. Research on biofeedback for stress incontinence shows mixed results. Some studies suggest that combining biofeedback with pelvic floor muscle training may lead to faster improvements in muscle strength and reduction of urine leakage. For example, one clinical trial found that both pelvic floor exercises alone and with biofeedback reduced leakage significantly after several weeks. Those using biofeedback saw improvements sooner, but over time, the differences between the groups became less clear. This indicates that biofeedback might offer a short-term boost, but in the long run, traditional exercises are just as effective. Larger studies have also looked at this. A major UK study involving hundreds of women found that both groups, those using biofeedback and those doing standard pelvic exercises, improved similarly over 2 years. Symptoms, quality of life, and the need for further treatment were nearly the same. This suggests that for most people, supervised pelvic floor exercises alone are enough to manage stress incontinence effectively. Biofeedback may be helpful for individuals who find it hard to identify or contract their pelvic muscles correctly. It can serve as a useful tool in personalized treatment plans, especially when standard exercises are not enough. It's important to remember that responses to treatment vary from person to person. Some may find biofeedback helpful for learning proper muscle engagement, while others may do just as well with traditional exercises. Currently, major health authorities do not recommend biofeedback as a first-line treatment. Instead, pelvic floor muscle training, often guided by a physiotherapist, remains the main approach. Biofeedback might be considered if exercises alone aren't enough, or if additional motivation helps. In terms of bladder health and bladder cancer, managing stress incontinence is about maintaining comfort and dignity. If you have a history of bladder cancer or are undergoing treatment, it's especially important to talk to your healthcare provider about any urinary symptoms. They can help determine the cause and suggest the best course of action. Overall, biofeedback is a safe option that can support bladder health by helping you learn how to strengthen your pelvic muscles. While it may offer some benefits for certain individuals, it is not a magic solution for everyone. Always consult a healthcare professional to see if biofeedback fits your specific needs. Personalized advice is essential because bladder health can vary greatly depending on individual circumstances and underlying conditions.